The Fin Forecast presents the Fin Forum, hosted by Marjahn Finlayson, with our special guest, Tezel Lightbourne.
Hi everyone, thank you so much for joining us again here at the Fin Forecast YouTube channel for another episode of the Fin Forum. My name is Marjahn Finlayson. I'm your host, and I want to extend so much gratitude to people who have subscribed and just watched a few of our videos so far. I can't believe we're on our fourth one, but on behalf of the Fin Forecast team, I want to say thank you guys so much for being here once again. Today, we are joined by a public health expert, Tezel Lightbourne, who is the founder and CEO of the Regal State of Health Consultancy in the Bahamas. Tezel has been working in this field for nearly a decade, and she's consulted with the Bahamas Red Cross, PAHO, and even the Department of Health in Arkansas. She's been doing this work very seriously since deciding that becoming a doctor really wasn't what she wanted to do, but rather working in the field of epidemiology, something that's so important and so helpful. She teaches me a little bit about One Health, communicable versus non-communicable diseases, how history makes an impact on us as a collective. It's an incredible conversation. I'm so excited to learn so much and talk to her. So if you find this conversation enlightening and want to learn more, please like and share this conversation with family and friends. And don't forget to subscribe to our YouTube channel. If you're someone who's interested in presenting your work and talking a little bit more with me about it, please send an email to jointhefinforum@gmail.com where we can talk more about working together. And without further ado, please enjoy the conversation that I have with Tezel Lightbourne right here on the Fin Forum. All right, welcome back to the Fin Forum. So happy to be joined by my wonderful guest, Tezel Lightbourne, who is an epidemiologist, has a master's in public health, and is simply amazing. Tezel, welcome to the platform.
Thank you for having me, Marjahn.
Thank you for saying yes. Before we get into everything, right? Like, of course, I'm going to ask the weather question, but like the presentation that I saw you give not way back when, but a while back, which I'm going to ask you about in a second, it was so impactful. And I just feel like public health, epidemiology, environment are such like big things to talk about. But, in the Bahamas and the Caribbean, we're really big on talking about like the health of coral, big deal. The health of like the ocean, but not necessarily how human health, animal health, all these health like things relate to the environment. So I was too happy to like connect and like want to like talk on a bigger platform.
So
yes.
Thank you again for having me. I think my career up to this point, I found a lot of clarity in why I was doing so much. And so to start off with, I'd like to give a definition for public health.
Yeah,
and
sure.
So public health is the science and the art of preventing disease, prolonging life, and promoting health through organized efforts of society. So notice that in the definition, they don't talk about the organization of efforts through only medical professionals or only through environmental professionals or through agricultural professionals. So it's by society as a whole. And so when it comes to the idea of people who are health professionals talking about the environment, I feel like it only makes sense. And then if you don't have that understanding or you don't have that appreciation, then you can find yourself seeing different climate events as random when they're actually not. Something that I spoke about during the presentation back in January with the Canadian Mental Health Society's climate informed counselors. I also thought that was so brilliant that they have that subset of their association that deals with climate informed counselors. So I talked about One Health, which is this partnership between 4 UN mechanisms. So it's the World Organization for Animal Health, the World Health Organization, the Food and Agriculture Organization, and there's a fourth one. But they came together to focus on One Health. So focusing on the health and well-being of animals, humans, plants, and the environment. And I like that recently they teased out the health of plants separate from the environment. I think when people think about the environment, they're all together. But I thought that it was a brilliant concept just because of the fact that all of those small subsets of society, they really are inextricably linked. Humans consume animals and plants. These things live in the environment based on the stewardship, whether that's good or bad, towards the environment, towards how we care for animals. That plays a direct impact on our own health and well-being. And it's not just the focus on the health of humans, but how are we stewarding animals? How are we making sure that medication that is only designed for animals are being used for them versus using human medication on animals? How are we ensuring that we're not degrading the coral reefs? How are we making sure that we're protecting the environment for conch? Let's say, for example, that we like to consume. How are we making sure that we're not over consuming and allowing them to repopulate as necessary? So that was a lot, but in recent times, I've become more excited to talk about One Health, just because I think it's something that everybody should appreciate, even if you're only focusing on one aspect.
It's interesting because like that's one of the concepts that I've learned about recently. And I was actually like getting into Rachel Carson's book Silent Springs. That was 62. She was talking about how like different chemical, basically how pollution and like different chemicals in the 60s were actually affecting like environmental landscapes, and how that like affects human health, environmental health, animal health, and like how all these things matter in terms of like, right, the last chapter I read was really about pesticides being like poisonous. And it's interesting because it's like one of those things where this book was a landmark in the US like environmental like sphere, right? And it brought a lot of legal environmental law and legal things that needed to happen in the 70s. Was like a big springboard. And it's interesting, like One Health is like a big initiative that's worldwide now, but it's interesting, like it's something that we've always cared about but haven't necessarily formalized so well on an international level, right? And like now I'm most people don't know this, but I'm obsessed with veterinarians, right? So there's like this thing where but there's a show about these veterinarians in like I think it's Atlanta in Georgia, and they just like the critter fixers. They fix all the animals, and like I'm obsessed because I'm like, somebody got to care about the animal health, because if they get sick, like something like COVID-19, like if animals get sick, that transfers to humans. If trees, if the environment isn't well kept and animals are sick, that can transfer to people and wildlife and people interaction. There's like a whole lot. And I'm sorry to get what's the word? Distracted.
Carried away. No, it's okay. Yeah. One thing I would say is that, particularly when I think about COVID-19, poor stewardship from humans has to do with deforestation as well. And so now, if you have this habitat that animals live in, but you destroy their habitat, now there's this greater likelihood or greater risk that humans and various animal species that never had contact, now they come into contact. And we don't think about the fact that the earth was designed in such a way that it was made for them to not come in contact in that way. And so I think there's a missing piece that a lot of people who prioritize development don't really consider, like what is going to be the long-term consequence of destroying this habitat that and there's a equal balance. So what happens when you destroy that balance later on when it comes to health? So I think more people should explore it and have real care for it, or at least have a professional in the space to discuss those considerations.
And you are that professional in the space to discuss those considerations, yes?
Thank you.
We have a lot to discuss. Because, I mean, when I met you, it was through the same like virtual presentation where you talked about One Health as an initiative. And then, like, you just explained the mission, so I'm not going to ask about that. But you spoke about how Hurricane Dorian and, like, hurricanes in general affect One Health, like, as the professional. Could you speak more about that to us, like where hurricanes would play a role in that?
Sure. So when you think about Hurricane Dorian, first and foremost, that was, I think there's never going to be a time when, there should never be a time when the Bahamas doesn't speak about it. That should be something that we reflect on, not just because of the fact that lives were lost, but I think there's a lot that could come out of it in terms of research studies. How do we practically plan? How do we make sure that there's multi-sectoral coordination for disaster preparedness? How do we now think about national development in terms of climate mitigation and adaptation? How do we just make ourselves more resilient? And so what I had talked about during the session back in January was that as a result of environmental shocks that led to people being displaced, mass displacement, that led to poor quality of life. So either people lost their lives or they experienced injuries, whether that's physical or mental. There was an effect on livelihoods. And within public health and epidemiology, there's this focus on social determinants of health. And so your income and your economic stability is a major consideration that, I guess, within the health space, some people, if they're not attuned, they wouldn't think about that. But there's a loss of livelihoods. And so that leads to fear, anxiety, and depression. And during those climate-related events, or even afterwards, specifically within the realm of mental health, that could lead to suicidal ideation, suicide attempts, suicide completions. And during my experience after Hurricane Dorian, I had moved to Grand Bahama to support this international NGO called Mercy Corps. And what we found was that there was a huge spike in suicidal ideations. There were a few completions of suicide along the path where we had the reverse osmosis tank. And I think in Caribbean countries like the Bahamas, there's this myth about mental health and people being weak and whatnot. But I think when you have all those shocks from different angles, when you have displacement, when you have people who've been separated from families, those are major traumatic events. And it's not something that any human should be able to cope with unless you have professional support to help you process those thoughts. Do you have the healthcare system that's organized in such a way, even during Hurricane Dorian, as well as COVID-19, even if you have those systems in place, they're now overburdened because they're already caring for a subset of people who are ill. And now you have this new event that brought in cases of like Legionnaire's disease that occurred in Grand Bahama, or now you have sitting water that's led to this uptick in mosquitoes. There's waste in water, and so then you don't have access to clean drinking water and whatnot. So there's so much that I could go into, but
and we'll get to it.
Yeah, One Health is really key, and I think that for a country like the Bahamas, a small island developing state, it's something that we really should be more mindful of, because the frequency and intensity of climate-related disasters are only going to occur even more.
Yes, research backs that up. And speaking of that, right now I'm in Europe experiencing a second heat wave, I believe. And I
Wow.
know that, yeah. And I know that there's been some heat waves last week hitting the Bahamas. And back to public health, could you talk about like how heat waves in particular make a dent in public health?
Sure. So heat waves impact health and public health in a variety of ways. So as I mentioned, the frequency of heat waves, that has an impact on the healthcare system, the ability to be able to meet it. And so something, I wanted to break it down in a few ways. So
Hmm.
there's issues with dehydration, heat exhaustion, and heat strokes, particularly among the young, the elderly, and people with disabilities. Um, Heat waves can also make the experiences of people who live with different chronic conditions much worse. And so, for example, people who live with diabetes, hypertension, that heat stress could cause metabolic changes in their bodies. And then, if they're taking medication as well, it could lead to the medication not being as effective or making their body have to regulate the internal cooling system at a much intense rate. And so, for people who live with hypertension, because of that overworking of their thermoregulation system, that could lead to blood thickening. It could lead to increasing their risk for stroke. For those who live with mental health conditions, the higher temperatures, it disrupts their sleeping cycles,
Mm.
and it can also alter brain function as well. Um, Traditionally, sun is helpful, but too much sun, that could affect your brain function. And so then also for people who have psychiatric medications that are prescribed to them, it could interfere with the body's ability to be able to sweat and regulate their system as well. Also thinking about people who have kidney health issues, that dehydration over a long period of time, that could lead to critical kidney injury, as well as damages to their renal system. And then with asthma, the poor air quality makes it more difficult for people to breathe, and so that could trigger asthma attacks. The reason that I focus more on non-communicable diseases is because the Bahamas has a extremely high incidence of non-communicable diseases and a growing challenge with mental health. And so if our healthcare system is already overworking to address these health issues, and then you have climate impacts like heat waves occurring, then that just puts a greater burden on the healthcare system. And then again, to social determinants of health with heat waves, foods that normally thrive. Of course, all plants need sun. If there's excess sun, that can dry out crops, and that can have an impact on food quality and food access as well. And in the Bahamas, we have a growing food security issue because we import so much. So those are just some of the ways that heat waves have an impact on public health.
Thank you very much. I can
You're
feel my
welcome.
brain function being affected, so I appreciate that. Could you tell me the difference between a communicable disease and a non-communicable disease?
Okay, no problem. So, a non-communicable disease has more to do with your lifestyle. And so, this has to do with diabetes and hypertension. It has to do with our movement and ability, our consumption of foods, the access to the environment that we live in, because it's more than just exercise and diet. Do you have poor air quality? That can lead to issues with asthma and respiratory issues. It can also play a role in potentially developing various cancers as well. Versus a communicable disease, there's an agent, more like a pathogen. So when you think about viruses, bacteria, and it enters the host, which is you. And then if your environment is not that great, then that can exacerbate the issue. So I would say that's the difference between non-communicable diseases and communicable diseases. non-communicable has to do with like the physical factors versus the communicable diseases that would be an agent or pathogen more so.
Okay. Thank you. I appreciate that. As you are an epidemiologist, I can say that, yes. Like it's important to know the difference. You know what I mean? Like I know things, but I don't know. I'm not a Wikipedia person. Could you tell us, as you are an epidemiologist, what epidemiology is exactly?
Okay. So there are a lot of different definitions that talk about the study of the distribution of health events and diseases. But I found this one that is very comprehensive and it gives more insight. So epidemiology is the study of the distribution and the determinants of health-related states or events in specified populations and the application of this study to control health problems. So to break it down, when you talk about the distribution, so how is disease in one community versus the other versus another group of people when you compare. So epidemiology is very observational and a lot of comparison in nature. It also focuses on the determinants. So you don't only look at the fact that hypertension is higher in men versus women. That's more descriptive, but to understand why is it higher in men versus women? What are their behavior patterns? What is their education level? Do men have a different understanding of what foods to consume compared to women? When you look at racial and ethnic health disparities, it's helpful to compare because if, let's say, a minority group has a higher incidence of a certain disease, let's say diabetes, what is the reason that people in this minority group compared to the rest of the population have this higher incidence? Is it due to their culture and tradition in terms of how they prepare foods? Is it due to poor access to healthy food? Is it because of the fact that they have historically been marginalized? So when you look at determinants, you're combining more of the hard science with social sciences to create this clearer picture. And that's what I enjoy about epidemiology a lot. Another thing that I wanted to just share is that there's two different types, or you can look at epidemiology in two ways. So descriptive epidemiology is where you have this available data where you can examine how rates in one group of people are different compared to the larger population. That's more descriptive. Whereas analytical epidemiology, you now have this development of a hypothesis, and you use that to determine association of risk for health events and health outcomes. And so then you're able to apply different testing methods where maybe one group of people you apply a particular medicine to, whereas the other group may be the control group where you just observe and you see how the application of this tool or this particular method makes their outcomes different. And then from there, you can develop policy recommendations. You can implement programs and best practices. So in terms of me being an epidemiologist, I have found myself more in descriptive epidemiology. And as I mature as a public health girly, my hope is to expand my skills and my technical experiences to be able to delve more into the analytical aspect.
And I love that you said, as I get more into it, because I want to talk about you anyway.
No,
because let's get into that, right?
Sure.
I really love that. So you've worked in every capacity ever. Like pretty much like we haven't said it. We're about like the audience is about to learn everything, right? And I want to talk more about it, obviously. So
Sure.
before we get there, I want to know what inspired you to go into this particular field. Like, I saw that you were pre-med at some point. So why didn't you become a doctor? Like, why did you go down this particular path? Is there like a childhood experience that you had, or is there something that really like was like, this is it, that's it?
So, of course, like most Caribbean people or families, they push their kids to go to law, medical school, because that's the areas that one have the most money, earning potential. Those are the career fields that people they're most known. And so that was my track. I went to Philander Smith College in Little Rock, Arkansas to study biology with a pre-med concentration. And so during my undergraduate experience, I went to what ended up being my alma mater, the University of Arkansas for Medical Sciences, to engage in some summer enrichment programs. So they had a summer science enrichment program, which was phase one. And then the next summer, they offered MCAT prep. And so I had participated in both summer enrichment programs. And during the MCAT prep, I had the opportunity to meet Black medical students and Black professionals within the allied health space. And one of them, she was completing her Master of Public Health degree and focusing on epidemiology. And I really liked the way that she showed how epidemiology really is the cornerstone of not only public health, but a lot of the insights that were founded through epidemiological study really helped to inform medicine as well. So when you think about cholera and how that had an impact on when you think about cholera and when you think about even sanitation of tools and its impact on women during childbirth, like how sanitation really could be between a matter of life and death. And you had this epidemiologist who was able to see that, yeah, you actually just need to sanitize your tools, because that's why women who are delivering are dying. Even the refrigerator, how a lot of people died from exposure to meats that weren't being stored adequately, and how implementing this or developing this simple tool kept meats cool and refrigerated so that there wouldn't be an opportunity for bacteria to grow. I would also say I had applied, and during a time when I didn't get accepted, I just thought about, well, what is it that I can do to supplement my skill set on my application, really. And in a sense, I'm glad that I ended up like going full steam into public health as opposed to using it as a way to build my application, just because of the fact that you really need more people who focus on the healthcare system as a whole, through research, through coming up with the data analytics, and how do you interpret those findings into policy and program, just because medicine can only tell you so much. I love that epidemiologists and public health professionals at large, they focus on larger communities. So there's community health, there's population health, and then there's global health. Whereas physicians, they only function within that. So they treat patients one-on-one, but they may not have that understanding to say, I'm noticing a trend. Do these people live in the same environment? Do they have the same exposures? Do they have the same health patterns? How can we change that on a higher level to affect more change? So that's what got me into epidemiology.
That's awesome.
I would say that something that I'm really interested in the future is pursuing the PhD in epidemiology. And so it's okay to divert. You can always still be a doctor, but a doctor who informs how physicians function in the larger scheme of things. So yeah, it's okay to pivot. And all of these professions are very necessary and essential to making sure that people are well.
And I think you'd be great in a PhD program. I mean, based on everything that I'm going to tell the audience, like, I think you'd be good. Listen, because a lot of people will discourage you from doing a PhD. You should do it. You're going to do great. That's just the facts of the matter.
Thank you.
Yes, of course. So, one of the things that you talk about is like making effective change, and especially like when you were in Arkansas, like you graduated and then you worked there for a little bit in the Department of Health there, I guess.
Mm-hmm.
And you worked with underserved communities, like underprivileged, like underserved communities. Did you, like, there's a lot of conversation about like, where there's like medical racism and things like that. That, of course, like sexism, especially for Black women in the U.S. Did you see, like, in your experience where the work in your field in epidemiology made a difference for people?
I think so. So an example specifically from the Arkansas Department of Health, it started out with developing a county's report. So looking at all of the counties within Arkansas, they just noticed that there was this huge disparity. There was a county's report that focused on NCDs, specifically in Arkansas. And what they found was that the counties that had a higher population of minorities, they also found that they had a higher incidence and prevalence of non-communicable diseases like high blood pressure, diabetes, and cholesterol. And they had issues with their conditions being uncontrolled as well. Mm-hmm. And so what the Office of Minority Health and Health Disparities focused on was creating a program so that they can, one, get those individuals linked to care because they may not have had a physician, a primary care physician. They also wanted to design a program in a way that it wasn't cookie cutter, that it was culturally relevant. And so we started to do research and understand what are the things that would draw these groups in. And so we found that barbershops and beauty salons was the common factor between Black and Latino American communities, where they may not have access to a primary care physician, but they're more likely to go and get their hair done, get their nails done. And so how do we bring care to them in a way that it's not intimidating, that it's culturally relevant, and that ultimately, if we find that people are uncontrolled, that they could be connected to care and make it easy for them. Mm-hmm. And what I found that was that over the years, because I was able to work with them maybe for about 2 years, and then just in keeping up with the staff, they did notice that the trends for uncontrolled diabetes, cholesterol, and blood pressure, it started to decrease over the 5 years. And I think that it had a lot to do with meeting people where they were, willing to be creative while still having that technical rigor. And then making sure that you also have professionals who look like them. I think that having the Black and brown physicians, medical students, pharmacists, which, by the way, 1 year I did meet another Bahamian. She's a pharmacist in the Bahamas now. I thought that was so cool. But we volunteered and we were able to connect with them in a way where we understand what our eating patterns are like. We understand what our comfort foods, but also teaching moderation, helping them to find healthy alternatives to the foods that they enjoy, or maybe encouraging them to use less salt or less sugar. Or how can you season this in a way where it's still flavorful, but and not bland, but it's still good for your health and helps you to have a more quality health experiences. If there were any misunderstandings about what the blood sugar test is like being more comforting and having it in a space where they're more familiar with. I think that really helped to make a positive experience for them. And then there were some people who their health condition was so high that they were immediately transported to the hospital. They were connected to insurance. I think migration or immigration status was a big thing as well, like a lot of fear. And so having it in that space, we were able to have maybe social workers who could say, this is how this person can still get care without the risk of them experiencing deportation and whatnot. So I think that's one experience I could call on that was really impactful.
That's excellent too. Like, pull on my heartstrings a little bit. That's just very nice.
I thought that was so brilliant on their part. I really love that.
Yeah, no, completely relatable. I mean, back in the day when I was at the hair salon job, that would have gotten me. I don't be there anymore. Just but so you were there, you were in Arkansas, you did impactful, incredible work, and then it's time to move back to the Bahamas where you're about to do more impactful, incredible work. And I want to talk to you particularly about 2019, 2020. Is that okay?
Yeah, that's fine.
Because I can imagine it's a little traumatic. Yeah, because for the audience, 2019, Hurricane Dorian, and then right after the COVID-19 pandemic, and lockdowns and everything else. So just to start, you mentioned you were at the Mercy Corps in Grand Bahama for a period in 2020. You were the senior program officer for water, sanitation, and hygiene. And then after that, you went to work at Coco Key with the Caribbean Cruise Line to navigate the pandemic. And that was like the year. Could you talk to us a little bit about the experience with COVID-19 and then Hurricane Dorian directly afterward, and how those experiences might have impacted you as a professional, and then also maybe on a personal level, if you're comfortable talking about it?
No, that's fine. So I guess just to go back up just a little bit. So at the time, I had just returned home, and home is New Providence for me. But I had a relative, one of my aunts, who was in Grand Bahama. My mom's family's from Grand Bahama. And it was from a personal experience, it's very terrifying to be on one island and hear about your aunt struggling to be able to get out of a home because an area that they didn't think would be impacted ended up being severely impacted. So she lived in Hudson Estates, and water started to flood into her apartment. And then to be able to move there maybe a month later, and you could see that there's still the water line on the wall. That was very emotional for me. So I didn't directly experience it, but just to think about what she went through, that made me very sad. And I was glad that she was alive and well. I stayed with her for a bit. And professionally, I always have some conflict about speaking about Hurricane Dorian and COVID-19, because I would say that, there were a lot of people who didn't have jobs and livelihoods. And I would say that probably was a period of my public health career where I learned so much, and I was never without work. Work was either extended or there were different projects that came up that I left one job and immediately went into another one. And I found that I don't know that a lot of professionals who work during that time talk about the conflict. Yes, you're grateful to have income, but having to have work that solves the problem and speak with people one-on-one, it's very heart-wrenching. I found myself crying a lot of days during work, just because it's I can't imagine that people went through this and you have to maintain a level of composure to still do the technical work, but just caring for people and understanding wow, they really have nothing. There were homes where like the entire structure was gone. And when you think about the building code of Bahamian homes, like they're very strong. So it speaks to how tremendous the storm was. So yeah, personally, like it just was very conflicting for me, but professionally, it was an opportunity to explore public health topics. And have a wide range. So there's water, sanitation, and hygiene. My focus had always been non-communicable diseases, but you learn very quickly that without proper water, sanitation, and hygiene, people with those NCDs have more challenges, or it makes them more vulnerable. Similarly with COVID-19, again, my background was always NCDs, but now you have this communicable disease that puts those with not NCDs at greater risk. And so I'm pretty sure when you go back and you look at the charts of all the people who had major complications or even die from COVID-19, they most likely had at least one NCD that put them at risk, like lung health issues, lung cancer, let's say, or even, hypertension and diabetes. And so it was a time to learn a lot, but it also was a challenging time. You talked about, or you mentioned the work that I did as a public health officer at Coco Key with Royal Caribbean Cruise Line. Overall, what I would say about public health experiences in commercial entities is that the bottom line is always, how do you make the most money? And so I think that experience taught me a lot as well in terms of par levels with like what is an acceptable rate in order for business to still continue. But I think that role also taught me that in the future, maybe commercial entities wouldn't be a place where I would want to perform public health, because there's always this kind of like a wrestle, like how do you maximize profits but also keep people safe? And I just found that, and I'm going to be very diplomatic, like I just don't think I would want to. It's a bit uncomfortable for me to work in spaces where you have that like wrestle. I think moving forward, I would like to purely be in spaces where health is the greatest priority. That's not to say that it wasn't a priority for them, but if there are competing priorities, then that's a challenge for me in terms of my personal ethos. So,
which I can imagine, like, not to do the comparison, but where do you a scientist, where do you get your funding, right?
Yeah.
Right? Like, completely understand. We don't have to get into it, but I get it. But then you're also good with like the disaster management is also one of your skills. Like you also worked at the Red Cross doing preparedness for effective response. How was that? More personally aligned? Like how was that?
So I'm fine. I find that I thrive in non-government spaces where there's neutrality, where there's more of a focus on technical work. And so that's the greatest priority. How can you build capacity, not just through training, but developing the policies, developing the systems, having a lot of multi-sectoral coordination. I found that I really enjoyed that experience. So in that, it had a lot to do with taking funding that came through a bilateral agreement with the International Federation of the Red Cross and the Canadian Red Cross, just to build the capacity of the Bahamas' Red Cross so that it can be on par with other Red Cross societies around the world. They did a lot of great work, but I think it was important to make sure that you have the mechanisms that make the Red Cross here in the Bahamas. And so that was a great opportunity for learning, to learn about disaster preparedness. How do you respond to disasters? There was an opportunity to focus on health and emergencies. And so I got to develop and facilitate 2 courses, one in infection prevention and control for the staff and volunteers, and then also this epidemic preparedness. So it was like a mini course in epidemiology. So that was cool to be able to teach people about the triad, this framework that focuses on the agent, the host, and the environment. That was an opportunity for great learning as well. And then just building the capacity, not only here in New Providence, but across the Family Islands. It also dealt with infrastructure, making sure they have the equipment to build an emergency operations center, developing a lot of policies and action plans as well, so that the next time they respond, they can be able to understand whose role is what, how do you liaise with the chain of commanders. So it was a great opportunity for learning for me.
That's excellent. I mean, like, and you know what, let's just take the impressiveness up again. Right. So let's just take it up again with this next question, right? So you also, like, in addition to all the places we just talked about that you've worked at, you also have worked with the Pan American Health Organization. That's PAHO for folks who don't know, / the World Health Organization. Yes, like that's this.
Yeah, the regional office for the World Health Organization.
Thank you. Like, so we're adding on to it. And like, in addition to all of, like, if we just take all the experiences you had with all these places and PAHO, like, what are key experiences from all of the places that have led you to found Regional State of Health Consultancy in 2025?
So the experience of working with a wide variety of brilliant people, honestly, that across the board, whether it was with Mercy Corps, the technical experts that were in the Bahamas, those that came over, the experience of working with professionals from different fields at the Bahamas Red Cross, and then, of course, being able to liaise with professionals in DC and then across the Americas to be able to provide technical support to the Bahamas and the Turks and Caicos Islands. I would say that was the richest part of each, where I was able to learn. They were able to, truth be told, there were people who referred me. So when the opportunity with the Bahamas Red Cross was ending, someone whose contract with PAHO was ending, they reached out to me and say, "Hey, would you be interested in working at PAHO?" They have short terms on how long you could work. And so she was willing to refer me just because I was another public health professional. And so it was the people that made it so great. The technical experience of doing duty travel, being able to engage with other PAHO consultants, that just made it, that period of my life, I'm talking about it like it was so long ago, but just coming across all people from different spheres and working together and being able to say, we're putting all of these puzzle pieces together for the betterment of serving others, was the best experience for me.
And that led you to start Regency, the Regal State of Health, yeah?
So something to answer that part, something that I noticed across all of them was that small island developing states, they would have the capacity, but not necessarily the resources. Another thing I found was that even when solutions were being provided, I think the missing piece was like culture. And so if there's this mindset that people are engaging in health behaviors, but you don't understand the historical context of the people who live there, like if you're either not Bahamian or from the Caribbean and you don't understand like why we eat certain foods the way that we do, because those foods maybe were all that we had, or this is just like part of our larger tradition as people from the African diaspora, then you can be at risk of creating cookie cutter experiences. Even with the name Regal State of Health, like I think that sometimes people experience things and they feel disempowered. And so I use the name Regal State of Health because I want people to not only feel that they are worthy of receiving good health, of experiencing good health and having quality health experiences, but just to also empower them to play an active role in it as well. And so being a Caribbean woman who has experienced somewhat firsthand, like the health challenges that are here, and also being on the other, what's that?
Okay, somewhat.
I'm trying to be more. So we live in this space and we see what the challenges are, like with the long wait times at clinics, or taking my dad to the hospital, after he had a stroke. How do you navigate like the lack of access to things like autism support for my niece, and just a variety of other things. And it's like, like I have these technical experiences. Maybe this is very audacious of me, but I think that I can play a role. A big factor that really contributed to me developing it was that, like, after the public health emergency declaration ended for COVID-19, job opportunities went from back to back to back to like like there was a long wait time, and so I thought about it, like, what would be the ideal role and how could I potentially create that for myself? So it was very audacious, but I just felt like I don't want that to be a career, like this long gap. And also I think that if I take initiative in packaging these skills, I can create a job for myself. I know what the public health sphere is like here in terms of employment. The need is essential, but maybe the roles aren't so plentiful. And so how could I redefine my public health leadership experiences by creating my own role, and in the future, maybe creating opportunities for other people through jobs or internships as well. I have not arrived at that place yet, but it's a goal. It's a goal.
Okay. Thank you for sharing that. You got to make sure the camera can catch your logo so people know Regal State of Health Consultancy. Yeah.
Sure.
Like, it's outside, like we're here. And also the website I mentioned in my last episode of Scott Johnson had a beautiful website. Tezel also has a beautiful website. And on there, there's a vision, right? And one of the questions I had about the vision for the consultancy was, what does it mean to dismantle the impact of colonialism on health systems, health outcomes, and health behaviors?
So we know that countries like the Bahamas and really across the African diaspora, we experience a very unique form of colonialism. And I just want to give the definition for colonialism and then like bring it to the Bahamas. But so according to EBSCO, which is a research database, colonialism is where one state or a group of states exert control over another territory and its inhabitants, characterized by political dominance. And so just across the African diaspora, and there's this growing conversation around reparations, but we've seen how the human trafficking and enslavement of Africans and their forced migration from Africa throughout the Americas and then being treated as chattel slavery. So now you're not even seen as human anymore. You're seen as property. How that's affected the health and well-being of people from who live within these spaces. So when you deal with displacement, now the foods that you used to have access to, the environments, the comfort, even you don't have that anymore. And the exploitation of our ancestors led to fueling capitalism globally. And so while slavery is ended, capitalism has not, and the exploitation that continues in different ways. And so I'm not, through my business, I'm not looking to save the world. Like, that's impossible for one person to do. But I would like to be able to quantify, first and foremost, like, or contribute to quantifying what the impact of colonialism is. How has that affected our access to healthy foods? How has that affected how our healthcare system has been designed as a still fairly new and newly independent country? What autonomy does the Bahamas and other small island developing states have? Something I thought about was, while working at PAHO, I was able to collaborate with people from other member states who weren't an independent nation. And so their ability to be able to participate in conversations and make the decisions, like, they didn't have the same authority to be able to make decisions for themselves. And so they had to be represented by the country that that oversees them. And I thought that was such an interesting experience because, let's say, I'm trying to think of a UK territory. So let's say the Turks and Caicos Islands, they are still a UK territory. The hope is that, let me use international health regulations, which govern how all countries respond so that you maximize health around the world. If they don't have that decision-making authority to say, as a small island developing state, we don't have the supply chain, we don't have the essential medicines to be able to respond to this catastrophe in the same way that the United States does, or another larger country does, then they're always going to be seen as non-compliant, but it's because of the fact that their size and their governmental structure doesn't accommodate for it. And so to the idea of health sovereignty, I think it'd be wonderful for all countries in the Caribbean to be able to independently design, implement, monitor their own solutions to improve their health in such a way that like, it's technically sound, but it's still honoring their culture. And I think, for those who aren't independent, like, they may not have that buying power, and they really have to engage in a lot of negotiation and hope that whoever is representing them at a particular conference or at a particular UN session, that they take those considerations and they're not all pooled together with, that country that oversees them, because then their experiences could become lost in that, So that was
priority.
Yeah.
And that's, very good. And you answered my question on health sovereignty as well in that answer. And it's just interesting. I do question, not like anything, I do have a question to you about like your interaction with people. So in terms of just like the health services you provide, the services that you provide, one of the things I noticed on your CV is that you speak, of course, English, but you're working to speak in Spanish and Creole. Like, how is that going? And in terms of like knowing other languages, do you think it is helpful to your work right now, or would it be more helpful, you hope, in the future?
So I'm working to build a level of, like a strong level of mastery. I don't want to call names of the platforms I'm using, but the one that I'm using now, it's fine. I feel that more engagement with people who are Haitian, who speak Haitian Creole or who speak Spanish could help me to be more fluent in it, to be able to converse in a way that's more realistic. So I'm hopefully gonna expand it into that kind of learning where it's more experiential. But I think that it's important just because of the fact that, again, culture is a huge component. And so sometimes things that are really essential that you want to express, they could get lost in translation. And I think that being able to speak to people in the language that's native to them could help them to appreciate why health is essential. So let's say, for example, I'm speaking to someone who's from Haiti. If you don't understand culturally that they really enjoy rice, which Bahamians do too, but even the preparation is different, or the way that they may enjoy like fish that could be prepared differently, and be able to communicate that in a way that's relevant to them, something could get lost. And then what could mean one thing in English could mean a variety of things in Haitian Creole. So I think just communicating with them, or even developing tools that when they read it, they can appreciate it and see themselves in this technical document is important. And I think that using tools like, let's say, Google Translate can only do so much, versus if you learn from someone who's from Haiti or from a Spanish-speaking country. There's even Dutch,
Yes,
in the
plenty of Dutch.
Caribbean. Then, like, you communicate in a way that it doesn't seem like, oh, well, this don't really translate, right? Or this isn't a smooth translation. I think learning the languages can help you communicate better, for sure, whether vocally or through print.
Thank you. That's excellent. I always forget Dutch. That's terrible on my part. The Caribbean, so diverse.
It is.
Okay, so let's talk about the services on your portfolio. Personally, I would be interested in environmental and occupational health.
Okay.
When I used to work in the office job. And what process would I have to go through to work with your consultancy if I wanted to do this?
No problem. So if someone was interested in working with me through Regal State of Health Consultancy, first and foremost, there's a portfolio page with the various services. And so what I've done was just taken my experiences to give examples of how I could be able to support you. So you can feel free to look through a portfolio of services. There's a link on each one where you can schedule a free 15-minute consultation. And that consultation would just consist of me asking questions, like going through a survey with you to understand what the needs are, what brought you to a place of having an interest, what your experience with working with a firm is like, to see if there's a good fit as well. From there, and going through the responses to the questions, then I would develop a set of forms that talks about the importance of protecting the information that's shared. And then once those are signed, then there'd be a partial payment, and then we develop the scope of work afterwards. And then once you agree that the scope of work is fine, that it meets all of the specifications, that is relevant to you, then there'd be ongoing communication while implementing the service, whether it's capacity building, whether it's policy development, whether it is engaging in environmental health work. So if there's an impact assessment that you're interested in, and then go through that. And you can let me know early on if you prefer weekly updates, if you prefer bi-weekly updates. You let me know what the frequency is that you prefer so that I can report to you and make sure that you're engaged and well informed about what's happening. And then at the end, there'd be, throughout it, there'd be the various payments on a schedule. And then at the end, there can be a debrief to talk about what the overall experience was like. How do you want me to hand this over to you? What training needs to be done so that if there's an organization that I'm working with and they just want me to do the initial work, which was what the service is for, and there's handover, how do I share this so that you have full capacity now? And then a final report as well. So that would be the overall process, but it's all laid out on the website.
I encourage everyone to go to the website. It is beautiful.
Well, thank you. I designed it myself. I was like, wow, not me getting my website design by.
Let's look at all the talent. I tell you, it's too much. It's just too much. Also, you're an author of an ebook for people, Caribbean people communities. That is
thank you.
Online. The ebook is called "Resilient by Nature Disaster Preparedness." Resilient by Nature Disaster Preparedness. Excuse me. How was it writing that book?
It was okay.
Yeah.
So it was a lot of taking from experiences during my work with Mercy Corps and the Bahamas Red Cross specifically. Like, I thought about presentations that I had made to the general public, to those that I work with. And so there are topics that have to do with water sanitation and hygiene. There's a chapter that deals with what is your evacuation plan? Also, what kinds of foods should you store so that it's not only preparing you to journey through a storm, but make sure that it's still nutritional in value. Going back to the water, there are different considerations that maybe people don't factor in. So the water isn't just for you to drink and cook with, but you also need to make sure you have additional supply to bathe with every day. In the event that you need to evacuate, what are the different documents that you need, whether it's your forms of ID, what list do you have for medical emergencies? Do you know where your nearest health facility is? Do you know what the role of that health facility should be during an emergency? So in a sense, it's personal adaptation as well. There's also a chapter that has to do with how do you keep your dwelling safe so that you reduce your risk of like damaging your home. If you have trees that are a certain level and they're close to your roof, like how do you cut those down as well? So I wrote it because I recognize that there are things that we didn't factor in, and that led to a lot of loss of life or a lot of displacement during Hurricane Dorian and previous hurricanes. And truth be told, it goes beyond hurricanes. I tried to make it comprehensive so that if someone in Anguilla or in Haiti dealt with the earthquake, like if you were to read this could be comprehensive so that you know how to navigate the unique hazards that affect your particular country or your sub-region within the Caribbean. And my hope is to work through and translate it into Spanish, into Haitian Creole, into French, and Dutch as well, so that it can be relatable. And then at the end, I have, what is it called? like mini quotes that come from different countries. Like in the Bahamas, you talk the phrase "when you can't hear, you just feel," and that has to do with preparedness. And then some sort of song that, or like a poem that is relevant to, you know, different countries, and that's an opportunity to learn about various Caribbean countries, so that we become more regional in nature. I'd say in the Bahamas, we still like the concept of being regionalist is something that we're very slowly growing into. But regardless of the country within our region, we're more alike than different. There are some nuances. And I think that the book not only helps with addressing those various hazards that we experience, but it also helps us to, like, through reading it, you can have an appreciation for what other countries are going to, should you visit, or you just have a greater level of sensitivity as well. Yeah, so that was the hope. So it was like technical and cultural all together, and real preparedness in there as well. And then if there's an interest to dive deeper into a topic, let's say it's an organization that wants to build their preparedness plan, then I'd be happy to facilitate that. So there's like small calls to action at the individual level and at the organizational level as well.
That's awesome. I can't imagine sitting down and writing down every experience. It's like there's like a level to it where it's like, all right, so I did all this work and it was incredible. I learned all these things. Now let me write everything down that's comprehensive so everyone understands. Like that, listen, like
that took a lot of editing, and it's like, like, how do I write this? Obviously, as a Bahamian, it took a lot of research to learn about what different countries, like what their cultural experiences are, what hazards are unique to them, because not all countries in the Caribbean region experience hurricanes. Some are more familiar with earthquakes, some are more familiar with landslides and whatnot. So it was really a labor of love.
But PhD is waiting for you. You already like wrote a dissertation.
I'm looking like multiple sources as well to say, okay, this is really what they say in Trinidad, or this is how they really function in Dominica. So
different from the Dominican Republic, two different places.
Yes,
See, on top of that, right? So, like, you know, just to summarize, we have authorship. You're an author. You're a disaster risk specialist. You're an epidemiologist. You work in public health. You have all these like things that we already talked about. Let's also add to this. Okay, one more thing. The president of the Youth Senate for the 2024 to 2026 National Youth Assembly. You are also that.
That was, so I'll say it like this. So first and foremost, we actually just had our closing ceremony last week. They, you know, due to the election, you know, and I guess not being sure, they decided to end it a few months early. When I joined, it had more to do with me wanting to understand parliamentary processes as a young person. I didn't go in, first of all, knowing that those roles existed. I just thought, okay, I really applied to be a youth member of parliament in the House of Assembly. I didn't expect to be put in the Senate. But then I learned that the structure was for younger people between the ages of, so the age range is 15 to 35. They had those who were younger in the House of Assembly. And then you had those more mature, older youth in the Senate. And so, you know, I'm thinking, okay, well, I'm going to learn about what a senator actually does. Like, what is their role in parliamentary processes? Like, how do you, like, learning about the checks and balances so that there is real democracy. And I had some friends recommend me, and I was like, I just reached, like, this is my first time participating in this. There are some people who
Everyone can see an actual born leader, and you missing it, but everyone else is seeing it.
And so then, with this being the inaugural cohort of for the 2-year term, it's like you're thinking about how do we structure this so that it makes sense, that we mimic what happens in the House of Assembly and the Senate. There is no, youth governor general. So, like, how do you develop these policy recommendations and then pass it off to the Minister of Youth and Sports? Now, it was Youth, Sports, and Culture a few months ago.
Right.
But,
there was a difference.
Yeah, it truly was a growth opportunity for me. One, to learn about the overall parliamentary system, how the Bahamas has one of the oldest parliamentary systems, within our Caribbean region in terms of like the structure and design. We follow the Westminster system. Like, what are the strengths? What are the challenges as we move forward into this more modern age? How do we strengthen it and make it more, put more rigor and have stronger governance? Opportunity really. Oh, go ahead.
No, let me ask you how that opportunity, that experience, really like affected you on a professional, like for your view on climate change, One Health, public health. Like, how did that experience like affect you on terms of like where you want to see governance and policy go for the Bahamas, the Caribbean, and even globe, I guess?
I would say that the experience, one, it gave me exposure to speak about issues. So then I really had to go and do research on what would be, like, what are other models that you see in other small island developing states beyond the Caribbean region, but even those who are in the Pacific Islands, like, what work are they doing? And like, where's the Bahamas? What strengths do we have? Where are we missing the mark? Or what are some opportunities that we could really lean into more international mechanisms through the UN? And how could we add more rigor? How could we be better stewards? And not only talk about why biodiversity and climate and environmental protection is important, but how can we like institutionalize that? And so one opportunity I had was to make recommendations at the Commonwealth Parliamentary Association's Regional Youth Parliament. Mm-hmm. And so it was geared towards the Caribbean, Americas, and the Atlantic region. But everyone was from the Caribbean. And there were a variety of solutions, not only in climate adaptation, but mitigation. There were nature-based solutions that were given. The perspectives, so mine was from public health. There were those who had an economic background, those who were educators, like how can we teach environmental protection and embed it into our educational system. So it was really rich. Again, opportunity to meet wonderful people from across our region. I got a chance to work on the youth policy for the Bahamas. And there was a section that had to do with climate, like how are youth in the Bahamas being impacted by climate and what key performance indicators we need to meet in order to make sure that youth between the ages of 15 and 35 not only adapt well, but how are we performing in that way? And just from a high level, what can we do to just make the Bahamas safer so that we can prepare for and adapt to various storms and other hazards. And then I brought up this word before, but there's this growing conversation around reparations. And so during my speech for the Regional Youth Parliament, I talked about using reparations as a vehicle to be able to fund the various initiatives related to climate. So climate is also a public health issue, but how do we fund it? I think that between actual funds through developing like this resilience fund, whether it's through getting the technical support and mandating that, I think it's something that we should look for. I think in the past, reparations has been a topic or a conversation that it seemed more like an idea. And I think what I try to do through my speech was talk about, okay, you can actually use demand reparations to fund these different things and start to quantify what the needs are, talk about what the statistics are, how are people being impacted here. Because again, small island developing states, we contribute almost nothing in terms of carbon emissions, but we get the brunt of the impacts. And so what are the demands that we need to make? And being able to quantify it helps the argument to become stronger, and it helps you to see it's not just historically what happened, but what we're experiencing now. And the call needs to be like very measured across, various spheres.
It sounds like to me, the reparations committee would love to have you as part of the team.
I'm on the reparations committee this year. So just a shout out to Dr. Nyambi Hall Campbell Dean. She's been an excellent chair. I joined late 2024. Yeah.
Listen, great, excellent work. So happy to shout them out. Absolutely. Okay, so before we get to the questions from the audience, because I know my cousin is excited. I know he's watching going, yeah, I'm ready. Okay, one of the things I noticed, right, is like, of course, you're a very intelligent person. That's not a question. But you're also very, very brave. Like, the more we talk, it's like, you have these opportunities because, like, you seem to like, oh, I wanted to learn about Parliament, so I just joined. Like, it's just like you're a very brave person. So I think because of your bravery and your intelligence and your experience, you are booked and busy. You are, like, in the words of Beyonce, one of one, the only one. Do you have any advice to people on staying employed or looking for opportunities in this field, or just looking for opportunities?
So thank you for that. I would, in full transparency, I have not always been booked and busy or properly paid, I'll say that. But I think that just being very frank, I have grown to understand and appreciate the mind that God has given me. I didn't realize how relentless I could be, because typically when people come home to the Bahamas, let's just say, and if an opportunity isn't present, they'll just pivot and say, okay, well, if I studied one field and it's not open enough, I'll just go into another field and maybe find my way back. I think one, having very supportive parents, and especially my dad, has been key. To being flexible, but within limits. So all of my roles, while they seem very different, I was able to see how health is really multi-sectoral. And I have a mind where I see health in all things. And there's such a thing called health in all policies. And I think that even if there was a role that was strictly, let's say, disaster preparedness, health is a factor that should be considered. And so I saw it as a strong point, and I made sure to insert it in there or like really sell it so that like I can still get like gratification from doing that role, from doing that work and inserting that, while also saying I'm opening myself to learning new experiences and truth be told, based on the times that we're in, it's important to be flexible and really and truly all the experiences up to this point really are relevant to the Bahamas and to the Caribbean at large. And there are so many complex and overlapping issues. And so I think had I been very rigid about only working on non-communicable diseases, my career would not have been so rich. I think it's important to have good relationships with people and do right, do quality work. Because had I not done that, I wouldn't have been referred to opportunities. I think even the opportunities that didn't end well, it had less to do with my performance and just more of like a leadership issue, in terms of how I was managed. I learned a lot about myself, like to be more discerning. Not every good opportunity is a God opportunity. And so, while it's a range of experiences, if I could go back, some experiences I either would not have taken or I would have asked more questions to understand, like, what is your management style? Like, how do you function? What is the ethos of this place? So you know what you're walking into. Only recently have I really said, wow, Tezel, that's really brave. Actually, this morning, I thought about it like, you do a lot, You do.
That's what I've been saying.
But like that comes with a lot of effort. I have experienced a lot of burnout. So I would tell other people like it's fine to like be open, but not to spread yourself so thin. And ultimately, whatever God has for you, it's going to line up. Give yourself time to recharge and reset sometimes. And then just not even to be too spiritual, but just ask God for his will so that the doors that are for you, like he'll open them and he'll send the divine helpers to support you along the way. But even when you make those missteps, like they're all still for your good. So all the experiences have been public health related, whether I was functioning in epidemiology or focus more on program management or health promotion or policy development. They all still fall under the realm of public health, and be open to various disciplines or topics within health, if that is an area that you're interested in. Environmental health is also a major pillar alongside epidemiology. So for people who have that interest in environmental health, they may not want to focus more on the healthcare aspect, but they can look at how environment has an impact on health too. So that's why I don't know, just be open, but within limits.
I love that. I really love that because it's true. It's true. You have to be open and flexible and build great relationships. If anything, if there's ever been a testimony to build great relationships, it's like this conversation right here.
Yeah.
Like just think about it, Tasha. You were like, people referred me. Like, yeah, I can see.
Honestly, even this, like, Marjahn, I just want to say thank you so much. So for people who are viewing, we literally were both panelists. And I was like, wow, this girl is so amazing. She's in Italy, like, doing the thing. I love how Bahamians are everywhere.
Everywhere.
The host was from the Bahamas, and then we both were on there. And then there was another lady who was from the Caribbean. And then Marjahn just reached out and was like, I feel like everybody should know about public health and epidemiology. And I was like, oh, thanks. And then she spun the block, and I was like, wow, God, you're so kind. Thank you so much.
Because I do, like, so important. Like, we just lived through pandemic. It's very important. You're doing, like, not to be funny at all, but you're doing very important work. Like, it's so...
Thank you.
Like, it's so critical. I feel like we live in a... Like, one of the things that I really find important about this particular forum is to remind people that there are larger fields within the field. You know what I mean? There's subfields. Like, yes, I mean, I'm not a scuba diver, but I know why people want to scuba dive.
Yeah.
Like everybody does want to help the corals. They are important.
Right.
But we also need to care about agriculture, wildlife biology, and health. Public health is huge. It affects all of us. And also, again, an unhealthy obsession with veterinarians right now. Might get over it later. But when you were speaking about what health in that panel, I said, this is my girl. That's it. Like, this is my girl. I have to know everything. So I'm happy to be here.
What's so funny? So while I worked at PAHO, we had worked on an action plan for One Health in the Bahamas. And the person who led that, she was actually a veterinary epidemiologist.
Yes.
I have to go back and give you the name, but she was just so brilliant, and it was really good to see someone who appreciated epidemiology, because apparently epidemiology is really big in the veterinarian space. And so to be able to work with her and learn about like bringing farmers and agriculture professionals, bringing those who are plant specialists, and then you have nurses and doctors like all in one area, or be able to talk to them and collate all the experiences. I thought that was so brilliant. I have to make sure that I give you her name because it doesn't come to my mind right now. But she's a veterinary epidemiologist.
Please do, because again, the obsession, but also like that's so incredible. I love that so much. Like it's like ever since 2023, I've been like, this is so important. Like one of my friends, I to this day I tell her, like, Johnny could get this part, I promise. But I will tell my friend, like, we'd watch Hallmark movies all the time, and I was like, what if they just made one about vets, man? Like, we're always getting all the like doctor shows about the doctors. We need some about the vets. Like, I need to know what's going on day to day. You know what I mean? Like, I need to know like what turtles they have to fix. I need to know what's going on.
That's so true.
I just like, it's a personal thing. That's why I watch on YouTube. I watch these vets, the same vets I told you about, the critter fixers. I watch them all the time because I need to know. But I love that. I'm so excited. Let's get to the questions from the audience because
no problem.
Oh, okay. Questions from the audience. Again, just some questions about the field and what you've been working on and everything else. And like for people who are young people who are coming up in the field, as I've been taught by my cousin, a young person. So the first question is, what are some career paths that can be taken with your undergrad college major, like something like environmental science, public health, into this field? Like, what are career paths?
So again, public health is this large umbrella. So there's environmental health. Are you talking about the bachelor's? Because I got a bachelor's in biology. Or are you talking about, okay. Bachelor's. So there's environmental health sciences. There is data analytics. So if you have that interest in both biology and math, you could look into biostatistics, or even, just go into data analysis. There is health admin. So if you have that interest in that way, there's also, traditional medicine if you want to pursue biology and then take some additional courses to prepare you for medicine, and that's an option. I think that there's marine science. So I think once you have that background, what's that?
We love marine science.
Right. If you want to go into marine science, that's an option. I met someone through the youth parliament. He was also a youth senator. He went on and studied oceanography. No, I think he studied marine meteorology, but his title, he could be defined as an oceanographer, which I thought was really brilliant. I was like, but I think even that is important to understanding how climate can affect the ocean and affect the animals. It can affect how we understand weather patterns, because excess heat could also, that's the fuel for hurricanes and other tropical systems. So I'm trying to think about what else. You can look into being a lab assistant if you're interested in an allied health field. Things like phlebotomy and whatnot, you can look into those. And then some jobs, they provide support with education. And so if you're interested in expanding your career, you can ask about certifications that the job offers and would be willing to pay for. There's a whole host. I wish I could name them all right now, but you don't only have to be a medical doctor. There are various sciences that you can explore. Something that came to my mind just now. I had a classmate when I was an undergrad who went on to understand the science and the chemistry of makeup. So she worked at, was it L'Oreal? She studied biology, but she got into learning about how makeup is made. So, there are chemicals in mascara and lipsticks. It's so expansive. So you don't even have to feel like if you're a makeup girly and you want to understand those things, just take those concepts and say what's available. There's also project management. That's a skill that I think regardless of the industry you're in, within the sciences, it's helpful. The same way we have the scientific method, how do you now put that, treat something as a project and then say you want to implement this from start to finish? What are the strengths and the challenges? How do you replicate this possibly and scale it up? So project management is also an option as well.
Good. That's good. That's perfect. I know he's sitting down with his notebook. The next question is, in today's Bahamian society, is the environment, and in your case as well, environmental health, prioritized as much as it should be? Why do you think it is or isn't?
I think there's as I've been doing reading, for whether it's personal work or a course I was taking, I see how environmental health has always been discussed, but I don't think it's been as prioritized as it should be. And so because of that, we're seeing these larger issues that make it more urgent. So from even before I was born in the 80s, and then, when I was a little baby, in the early 90s, there's always been people who've been in the environmental health space, but I don't think the political will is followed to make it as great of as a priority as it should be. And so now we are 30 plus years into the conversation, and now we need even more environmental specialists, whether it's from a sustainability standpoint, whether it's from a governance standpoint. But then there are still behaviors that we're engaging in as stewards of our environment that it's kind of counterproductive. And so I don't know how to put it. We have the mechanisms and we have the professionals, but I think just at a high level, it hasn't been prioritized. And so it makes the work that much more difficult when you think about our landscape as a tourist destination, and how do we adjust our environment to accommodate that. I would like for there to be more environmental health specialists who invade the tourism space, to be honest. And even if there's this shift towards like envirotourism, where like you celebrate the unique environment that the Bahamas has. You focus on the different species that either are unique to the Bahamas or it's like endemic to the. Go ahead.
Don't worry, we got that coming.
Okay.
That was our last forum. Don't worry.
Right. But yeah, I think it could be more prioritized and institutionalized where there's more accountability for sure.
Thank you for that. And the last question from the audience is really about job security. Is there good job security in Nassau, or will I have to move somewhere else? And will I find jobs that pay good money? Now, answer to the best of your ability. If
That's a loaded question.
Yes.
So it took me a while to get to close to where I would be paid, let's say if I were in the US or someplace else. There's the growing conversation around, like you need experience to get a good job, but obviously I have to be given the opportunity to have the job to build the experience. I think it's a larger conversation around how we accept people who go away to school and come back, because we celebrate people who go away to school, but I think there's a lack of preparedness on the country's end. So I think that's a national development issue. And then I wrote about this on Twitter a couple of days ago. I would like to see the Bahamas conduct a needs assessment in terms of skills, like what areas are really priority in order for us to in order to get to the next level. And when we think about our current circumstances, and then ask yourself what careers need to be elevated. Like, how do we shift things around so that we get to where we want to go? What is the current capacity? Do we have enough people who are Bahamian who fill that role? And that's no shade to expats from other countries, even from within the region. But I think the Bahamas really does have a unique environment, and you need Bahamian professionals who are from here and who understand the culture to be able to, respond appropriately.
Right.
And then how do you create those pathways for learning? So in the past, if there was a priority towards funding medical school students, they're always in need. But what other areas are important for our national development, and how do you create the opportunities so that Bahamians can go away, study, and come back, and then also be adequately paid, because brain drain is a real issue. And you can't say that all people want more. It's no, the market is very clear that this is what the appropriate pay is for that degree, no matter which country they're in. So I think if we prioritize paying people well, there'd be more satisfaction. You'd see people actually go to the areas that they want to go into and perform well. So you'd see more productivity as well. And you'd see more Bahamians be willing to return home and stay home. Most, we like to travel, we like go. But yeah, there's nothing like home. And I think that is a barrier that makes Bahamians want to either stay away or move away.
Very true.
Yeah.
Well, I think that would be the end of the questions from the audience. The only closing question I have is, what is your star sign? Are you a Taurus or are you a Capricorn?
I don't even follow horoscopes anymore, but I'm a Leo.
Capricorn. You're a Leo.
My birthday is July 30th.
Don't tell people your birthday for free. But
you got that.
Chop it up. Girl, okay. Maybe that explains the bravery. You like in the sun. I could see it.
I was shy, or I think confidence, I think, may have been the thing that I struggled with early on. But I just realized like nobody is coming to save you. And on a more positive flip to that is like I am my own rescue. Obviously, God is my strength and my help, but like I am my own rescue. And so when I lean into that more, it just made me say, like, how could I create this, or how can I like show up in this space? And then what did I need when I was younger? So I really think about that too. Like, I wish I had someone who pushed me more, and how can I take that on? Like, be willing to take the risk. I haven't reached perfection yet. And truth be told, I was feeling a bit down about how things were going in my business. And recently there's just been like this burst in interest. And so time and seasons for sure. And I think if you're diligent, it takes a long time to really build a business. And I think it's kind of hard to tell, like, okay, when should I discern like to keep going, and when should I learn like maybe this isn't working? But yeah, ultimately nothing before its time.
I'm feeling a little emotional. That's very nice.
I was emotional. I was like, girl, don't cry on these people, bitch.
You don't be crying, you crying. Okay, so those are beautiful closing statements. We're gonna leave it right there. Please, can you tell people where they can find you, where they can connect with you if they're interested in, one, in your services, and two, in just connecting with you on a level of like, I want to learn, I want to be like you. How do I, talk to you about being like you?
So thank you for that. So through my business, the name is Regal State of Health Consultancy. So the website is regalstateofhealth.com. In terms of the socials, those are all there. So we are on TikTok, Twitter, now known as X, Facebook, Instagram, and most of those pages are Regal State of Health. I think Twitter is Regal State Health. You can explore the page and learn how to work with me through there. On a personal note, if you want to connect with me, you can follow me on LinkedIn. So my name is Tezel Lightbourne, Tezel, and that's Lightbourne with an E at the end. And I'm willing to answer questions. I'd like to get to a space where I generate enough income to appropriately pay interns and hire people for support. I have had people reach out, but unpaid work is very exploitative to me. So I haven't accepted anybody because it's like, I want to appropriately pay for time and effort. So, but feel free to follow me there.
What a wonderful politic to have too. Like, that's so good.
Because I know the struggle.
It's been so good to have you and reconnect. Oh my gosh, I'm so happy that we got to talk and that you are a part of this episode. It's so good to have you. Thank you so much for being here, and thank you to the audience for tuning in and joining us again. This is the July episode. We're so happy that you've joined us for the past 3. Stick around, and we'll have another one coming out later. Thank you again for joining the Forum, and Tezel, thank you again for being here.
Thank you so much to Marjahn. I really appreciate you.
Okay, let's not cry.
This has been the Fin Forum, brought to you by the Fin Forecast. Follow us on Instagram, Facebook, and LinkedIn. And don't forget to hit the subscribe button.